Hello everyone and welcome to pharmahutandhealth. Today, we'll briefly discuss about the human body's 13 clotting factors, their role in our body, what if VMD, untreated VMD medication, dosage and precautions. Before starting the video, please subscribe our channel pharmahutandhealth and hit the bell icon for more medical informative videos. Your one click will motivate us to make more educational, informative videos for you. If you have any comment or query, please comment. The clotting factors are an important part of this process, so let's dive in and learn more about them. The clotting factors are proteins that work together to form a blood clot. They are numbered from 1 to 13 and are produced in the liver, with the exception of factor 3, which is produced by platelets. Factor 1, Fibrinogen, is a soluble protein that is converted to fibrin during the clotting process. Fibrin forms the structural basis of a clot. Factor 2, Prothrombin, is converted to thrombin, which is responsible for converting fibrinogen to fibrin. Factor 3, tissue factor, is released by damaged tissues and triggers the clotting cascade by activating factor 7. Factor 6, calcium, is not a clotting factor itself, but it plays an important role in the clotting process by enabling the clotting factors to bind together. Factor 7, proaccelerating, is a cofactor that helps to activate factor 10. Factor 6, 7, 8, 9, 10, 11, and 12 are all enzymes or cofactors that work together in a cascade to convert prothrombin to thrombin and fibrinogen to fibrin. Factor 13, fibrin stabilizing factor, is responsible for stabilizing the fibrin clot by cross-linking the fibrin fibers together. What if VMD left untreated? Untreated clotting factor deficiencies can lead to bleeding disorders such as hemophilia A and B, von Willebrand disease, VWD, and rare clotting factor deficiencies. These disorders can result in excessive bleeding after an injury, surgery, or dental work, and can lead to severe complications. Hemophilia A and B are the most common inherited clotting factor deficiencies. Hemophilia A is caused by a deficiency of factor 8, while hemophilia B is caused by a deficiency of factor 9. If left untreated, individuals with hemophilia may experience frequent bleeding episodes that can lead to joint damage, chronic pain, and even death. Von Willebrand disease is caused by a deficiency or dysfunction of von Willebrand factor, VWF, which plays a crucial role in blood clotting. Without enough VWF, individuals may experience bleeding episodes that can be difficult to control. Rare clotting factor deficiencies, such as factor 2, 5, 7, 10, 11, and 13 deficiencies, can also result in bleeding disorders. These disorders are typically less severe than hemophilia or VWD, but can still cause significant bleeding complications if left untreated. Without proper treatment, individuals with clotting factor deficiencies are at risk for developing serious health complications, including joint damage, internal bleeding, and even death. Treatment options may include replacement therapy with clotting factor concentrates, medication to stimulate the production of clotting factors, and lifestyle modifications to reduce the risk of bleeding, such as avoiding contact sports and taking precautions during dental procedures or surgeries. Treatment available for von Willebrand disease. 1. An individual can apply a little amount of tranexamic acid, tranexamin, using cotton or tissue to clot the blood immediately. 2. Individual can take tranexamic acid, tranexamin cap 500 mg to stop bleeding, imitate bleeding, but tranexamin acid stop bleeding for very short time. Role of VWF or factor 4 injection in the treatment of von Willebrand disease. VWD is a bleeding disorder caused by a deficiency or dysfunction of von Willebrand factor, VWF, which plays a crucial role in blood clotting. The condition affects both males and females and can range from mild to severe. Let's explore how VWF injection can help individuals with VWD manage their condition. VWF injection is a treatment option for individuals with VWD who are experiencing bleeding episodes or who need to undergo surgery or dental work. The injection contains a concentrated form of VWF that can help to promote blood clotting and control bleeding. The injection is typically given intravenously, and can be administered at home or in a medical setting. The dose and frequency of injections will depend on the severity of the individual's VWD and the nature of their bleeding episode or surgical procedure. VWF injection can be used to treat a variety of bleeding episodes, including nosebleeds, heavy menstrual bleeding, and bleeding in the joints or muscles. It can also be used as prophylaxis to prevent bleeding during surgical procedures or dental work. The injection is generally well tolerated, but some individuals may experience side effects such as headache, nausea, and allergic reactions. It is important for individuals receiving VWF injection to be monitored closely by their healthcare provider to ensure that they are receiving the appropriate dose and that the treatment is effective. Dosage of VWF injection and precaution while taking. VWF injection is a treatment option for individuals with von Willebrand disease, VWD, who are experiencing bleeding episodes or who need to undergo surgery or dental work. Let's explore the appropriate dosage and precautions that individuals receiving VWF injection should be aware of. The appropriate dosage of VWF injection will depend on the individual's weight, severity of their VWD, and the nature of their bleeding episode or surgical procedure. The injection is typically given intravenously, and can be administered at home or in a medical setting. For individuals with mild to moderate VWD, the recommended dosage of VWF injection is 20 to 40 IU/kg of body weight. For individuals with severe VWD, a higher dosage may be necessary. It is important to note that the dosage and frequency of injection should be determined by a healthcare provider and should be tailored to the individual's specific needs. Precautions that individuals receiving VWF injection should be aware of these include allergic reactions. Some individuals may be allergic to VWF injection. Symptoms of an allergic reaction can include hives, difficulty breathing, and swelling of the face, lips, or tongue. If an allergic reaction occurs, medical attention should be sought immediately. Blood clots. VWF injection can increase the risk of blood clots in some individuals. This risk is highest in individuals who receive high doses of VWF injection or who have a personal or family history of blood clots. Viral transmission. VWF injection is made from human plasma and therefore carries a small risk of viral transmission. However, the risk of transmission is extremely low due to the rigorous screening and testing of plasma donors. Pregnancy and breastfeeding. The safety of VWF injection during pregnancy and breastfeeding is not well established. Women who are pregnant or breastfeeding should discuss the risks and benefits of VWF injection with their healthcare provider. Conclusion. In conclusion, VWF injection is an effective treatment option for individuals with VWD who are experiencing bleeding episodes or who need to undergo surgery or dental work. The appropriate dosage of VWF injection will depend on the individual's weight, severity of their VWD, and the nature of their bleeding episode or surgical procedure. Thank you for visiting my channel.